Daktari, let's talk about the procedure today. What was it, and what health condition leads to this kind of heart procedure?
Thank you, Joy. And this morning we have been doing a procedure for patients who have rheumatic heart disease affecting the mitral valve. In this case, specifically mitral stenosis. As you may be aware, there is a big burden of rheumatic heart disease in our country, and this procedure basically is for patients who have severe mitral stenosis. What that means is that there is the valve, or mitral valve orifice, is narrowed by the scarring and fibrosis that occurs when the rheumatic inflammatory process is ongoing. This narrows the mitral orifice to a point whereby there is very little blood flowing out of the heart, and basically this leads to heart failure. Patients with this condition basically will have difficulty in breathing, difficulty in doing daily activities, and some of them will have edema, and there are various other complications that can arise as a result of severe mitral stenosis, which include stroke. And several of our patients that we have been doing this week actually have stroke. So basically the procedure...
Yeah. If you could explain the procedure, how you go about it.
The procedure is called percutaneous transvenous mitral commissurotomy. It is a procedure to open the mitral valve. So basically the procedure is we access the femoral vein, which is a vein found in the groin, and that is where we push our catheters through, and we get to the right side of the heart, in this case the right atrium. Once we get to the right atrium, we make a puncture and we cross over to the left atrium, and from there we are able to access the mitral valve. And basically now, once we are able to access the mitral valve, so we push a balloon all through the vein to the right atrium, left atrium. We go across the mitral valve and balloon it to open the orifice. So basically that is what the procedure involves.
Looking at the cost and also the availability of this kind of procedure, not only in Kenya but also at Kenyatta National Hospital, what does this mean?
The fact that we are able to do this procedure in the public hospital is a big boost, because we have a very big burden of rheumatic heart disease, and also it is important at this point to say that NHIF is covering all the cost of the procedure, which is about 400,000. So I think it's going to benefit a lot of our patients.
So talk about the partnership between Kenyatta National Hospital and JICA. Who did you have at the hospital for this week?
So how we came up to do this particular project, it's been a training process that involved the doctors from KNH going to Japan, getting trained, and initially we did this on 3D models before we could actually do the procedures on patients. And so it's basically we can say transfer of skills. So we've been able to raise our competency level to a level where we can basically do these procedures on our own. So JICA sponsored the project through and another company called Tori and KNH. We had an agreement, so we were able to bring one of the top specialists for this procedure, a gentleman called Dr. Inoue, to help us in the training. So basically, it's been good going. Dr. Inoue is a top specialist in mitral balloon valvuloplasty. Yeah, he also is the innovator of the Inoue balloon.